Namaste, my dear brothers and sisters. The love and blessings of the Mother and Sri Aurobindo to all of you from Sri Aurobindo Ashram Delhi branch. I have with me here today two Ayurvedic physicians, Dr. Surinder Katoch and Dr. Mukta Katoch Arora, a mother and daughter team. One very young, as you can see, but very bright, and another who is not so young looking, but very young at heart. And again, a very bright Ayurvedic physician, both of them closely associated with Sri Aurobindo Ashram Delhi branch. Uh, Today, we are going to have a discussion on polycystic ovarian disease, or what is now being called polycystic ovarian syndrome, which is assuming almost epidemic proportions. Every second or third young girl you talk to has either this disease or some symptoms which can be understood in light of this syndrome. And in fact, I read somewhere recently, it may or may not be true, that this disease does not find a place in the ancient Ayurvedic texts. So let me first check with the experts whether it is really true, and then we go further.
No, it's not true. We do get the references in Ayurveda texts, and the main classical texts of Ayurveda, Charak and the Sushruta Samhita, they are there because we have 20 types of yoni vyapad. So in those 20 diseases, there are the symptomatologies of this disease over there. Then we also have the Asht Artav Dushti. So there also these symptoms are there. So it's, of course, yes, the disease is there, the description is there, but the way it is happening nowadays and the percentage of female patients coming to us with PCOD, or as you rightly said now, is a syndrome, the polycystic ovarian syndrome, that percentage has drastically increased.
In modern medicine, also, in fact, it was described only in the 1930s by Stein and Leventhal, which means that this is a relatively new phenomenon. Earlier, probably the disease did exist, but it was extremely uncommon, and therefore it was not taken much notice of. Which means that it can be said to be the result of the many uncivilized things that we do in the name of modern civilization.
Yes.
So, why it's being called the polycystic ovarian syndrome is because it tends to occur like a cluster, often associated with, if not diabetes, at least impaired glucose tolerance, hypothyroidism, fatty liver, and several other things which are commonly known to be associated with the lifestyle. They all occur in a cluster, and there seems to be a causal relationship, and one can probably all trace it to the lifestyle. So maybe you can talk a little more about this cluster as a whole, with maybe a little more particular reference to this polycystic ovarian disease.
Sir, nowadays when we see patients, as you rightly said, after every 3-4 patients, I'm having a case of polycystic ovarian syndrome. As rightly said, and as I am a Prakriti analyst also, and my main work is to rule out the causes of a disease. So when I rule out the causes of a disease, I'm surprised to see that majority of patients, almost all, they are following the lifestyle which is opposite to the lifestyle prescribed in Ayurveda. And it is not here. Everywhere, the children, the middle-aged group, the elderly group, all are following nowadays the same lifestyle. And as now of today, it is mainly the lifestyle disorders which are more nowadays. And in these lifestyle disorders, all those things which you named right now, like hypothyroidism along with PCOD, very common, very, very common. Diabetes and PCOD, very common. Hypertension with PCOD, very common. Then coming to psychological disorders, Kam, Krodh, Lobh, Moh, Shok, Bhay, Isha, Dvesh, Man, Apman, all are there. Irritation, frustration, depression, anxiety, neurosis, all these conditions, they all are coming together. The mind and body, Both are being affected. And this is because of the wrong lifestyle. And one of the major wrong lifestyle which is happening as of today is our sleep pattern. The sleep pattern, majority of the people whom we ask, they usually sleep 12, 1, 2 a.m. That is on average the time where the people go to sleep, whether it is children or middle-aged or higher elderly people. How can you have a healthy life if your sleep pattern is not good? Because when you talk about Ayurveda, there are three pillars of health, and sleep is one of the major pillars. And that is completely distorted. And at night from 10 p.m. to 2 a.m. is actually the rejuvenation procedure. That happens at that time. And a good sleep gives us normal hormones. A disturbed sleep, less sleep, inadequate sleep, deprivation of sleep. When I'm talking about sleep, it means night sleep. The sleep in between 10 p.m. to 6 a.m. This duration. So if we are not having a good sleep at this time, this disturbs our hormones. And this disturbs our biochemistry. This disturbs our repair process, as wear and tear has to happen. But the repair time is also not being used for repair. That also is being used for wear and tear. So where will repair happen and how will the physiology be okay? It will not be. So we are hampering our life ourselves, and according to Ayurveda, Ratri Jagran, once we are awake, we are disturbing Vata as well as Pitta. So in metabolism, anabolism and catabolism is there. So catabolism is going to increase, anabolism is going to decrease. So wrong formations are going to happen in the body. And that is polycystic is one of the wrong formations. So therefore, when we talk about lifestyle, ahar, nidra, brahmacharya, these are the three major pillars of health, and all the three are distorted today. Ahar, absolutely distorted. The food, the what we are eating, how we are eating, when we are eating, it's all distorted, and the food is not being digested properly. There is no time for food. We are talking and eating, we are walking and eating, we are driving and eating. There is no time to eat. There is no time to sleep. And brahmacharya का तो पता ही नहीं लोगों को. Because brahmacharya में the sexual behavior also has become very distorted nowadays. And the acharan, the behavior of people have also become very distorted. So the pillars of health, the food, the sleep, and our behavior, our acharan, all the three are distorted. We are bound to have lifestyle disorders. They have to happen. So if we really want to avoid these, we need to take care of our food, of our sleep, of our behavior. It's extremely important of our thoughts. Like in PCOS, what happens? Ayurveda says body affects mind and mind affects body. Our thoughts, they are the fuel for our mind. And what are the thoughts nowadays of females? I am a female, I'm talking about females. In females nowadays, we have a thought. We are more than men. I can do everything what a man can do. We are either equal to man or we are more than men. So if my thought is I am a man, I am more than a man, then what is the result in PCOD we are having? We are having mustaches. We are having beard. So we are having hair. So the Shakti, the femininity which we have, We are not acknowledging that. So this is a thought process of today, of almost every woman. I am a feminine, I need to have a feminine character, and I have a Shakti in me. I don't want to accept that Shakti. I think Shakti is in male. Therefore, I always compare my Shakti with male. I am more than man. Why should I say that? That both the Shaktis are within me and I need to balance that. So if my thought is always this, no, I'm not going to be under any man. I am more than man. So develop the men characteristics. So androgens are going to be more dominant then. So if they are going to be more dominant, then we are going to have those characteristics. So that is how what the role of mind is. So mind is affecting. Therefore, in all these diseases and lifestyle disorders, we need to take care what I am, that acceptance is very important. So all these things play a role, and the lifestyle is very important to follow a good lifestyle with again a formula of 4 for 4. If I want everything in harmony within me, my mind, my body, my organs, my soul, if I want that harmony, I need to develop those characteristics where I can work on my physical, mental, social, spiritual well being every day. And I need to take care of my food, my daily schedule, my behavior, my thoughts. My thoughts need to be responsible. My thoughts need to be rational. But we don't think about it. So therefore, the way we are living nowadays, that is actually taking us towards this, which we are calling lifestyle disorders, and those types of diseases which are incurable. The people nowadays, they don't want to produce the children. They don't want to produce the children. So if you have that mindset, then you are developing that disease that you can't produce a child. So when you reach the age of 40, then you think, I want to produce a child. Till 40, you had that thought, you don't want to produce a child. And you were always comparing yourself. So these things do play a role in our body, and we need to think about that. So therefore, the whole lifestyle, taking care of body, mind, organ, soul, everything is important as for the Ayurveda concept is.
Thank you so much. In fact, you have made some very interesting points. When we think of the high androgen levels and infertility, in modern medicine, we have a tendency to explain all this on the basis of biochemical mechanisms. But
Yes.
probably what we forget is that the mind body relationship works here too. And that
Yes.
one can understand also in terms of biochemical mechanisms because the thoughts and feelings, they affect the hypothalamus, and
Yes.
it is from the hypothalamus down that we have that entire axis going through the anterior pituitary to the ovaries. So thoughts and feelings are very important, and therefore one can probably understand these high androgen levels and infertility also in terms of the mindset that we have developed. And all this has happened in the name of feminism or empowerment of women.
Yes.
What we forget is that, as you said quite rightly, that the feminine Shakti is something which is inbuilt,
Yes.
and it's quite different from the masculine, if at all there is anything like masculine Shakti. It is different. Of course, I mean, I'll not go into the cliche that men and women are equal,
Uh,
but they are not the same, they are not identical, they are different, and so on and so forth. But the fact is that a woman actually is not weak, she's stronger. Whether we
yes.
look at the survival of the female newborn, it is in general slightly more than that of the male newborn. Or
Yes.
whether we look at the lifespan as a whole, the life expectancy of women is slightly more than that of men. Now, these are statistical facts, which means that the woman is not weak. But
Yeah.
then the woman has started arguing on the basis of the conditioning that has been created by the man's world. So men have created some conditioning in the society, and the woman is giving into that. And what is that conditioning? That conditioning is that a woman is weak as compared to a man, a woman is inferior to a man, and a woman is incomplete without a man. Now, none of these things is really strictly speaking true. Yes, a woman is incomplete without a man, but a man is also incomplete without a woman. And the two together are there for many things. provide support in many ways, including spiritual support, supporting each other's spiritual growth. But then they are also there to produce babies. And producing baby is not in any way separate from in their spiritual partnership, because as the mother has said, that producing a baby is more than just producing a baby. It is an act into which the mother can put in her entire consciousness and work on it, that the baby that is born at the highest possible level of consciousness. So she can influence the consciousness of the baby even while the baby is inside the mother's womb. And uh, in fact, unless we try to fight it with willpower, that no, I will fight this conditioning, this thing, concept that has been created by men in this world, that a woman is inferior and a woman is dependent and a woman is weaker and so on. I'll fight it by doing everything that a man does. And in that process, we come to believe that having babies will interfere with that process. But then what we forget is that producing a baby is not something which is something superfluous or dispensable. And that's what you quite rightly said, a woman realizes when she's about 40. Because for a woman, motherhood is inbuilt. And nature has overloaded us, or the divine has overloaded us with this need for motherhood in women, particularly, because otherwise, how will the world run? The world has to continue. And for that emotion, that need, that for motherhood has been planted in a woman, not only to produce babies but also to nurture babies for several decades. And the woman is able to do that so happily and willingly, giving all of herself, neglecting herself, only because this has been planted in her so nicely. And that is all understandable in terms of the future of the society, future of the world, because that is how the world continues. Now, these broad things, these basic things, we forget and sometimes get carried away by these notions and fight the notions created by men in the men's world in men's language. Actually, that's what women end up doing sometimes. So, with that little digression, let's turn to the young doctor who, till maybe about 10 years ago, was living in a hostel with many other undergraduates in an Ayurvedic college. So you have been in touch with young people for much longer, for a long time recently, and still are, I'm sure you have many young friends. So maybe you can give us the young uh, person's perspective, particularly the perspective of the young girls today, and how it relates to the disease we are talking about, polycystic ovarian syndrome.
Thank you so much, sir. So, firstly, I think naming a disease is not so important. From where we started, that there is no mention of this in the Ayurvedic text. So, Ayurveda does not give a lot of importance to naming the disease, that it has to be given a name. The more focus is on identifying what are the doshas and what are the dushyas that are involved. If you can understand what out of Vata, Pitta, Kapha is involved, it's very easy to treat. So understanding that is given more importance. And like Dr. Katoch has rightly said, that we do find a lot of reference in Ayurveda for these diseases. And uh, if research papers are available on saying that there are no references, it's mainly because they're trying to equate a modern disease with an Ayurvedic disease, and they cannot find a direct correlation because it's a syndrome. There are so many symptoms. So there is no one umbrella term for it, but yes, we can define all these symptoms. Now, when we come to understanding PCOS, Ayurveda has elaborate charyas, okay, different regimens. You will have a dinacharya, you have a ritucharya, you have a ratri charya. Okay, then you have brahmacharya. Brahmacharya, a lot of people take it as celibacy, but it is not celibacy. Okay, brahmacharya has a deeper meaning, brahmavat acharan. And then again, when we come to the sexual part of it also, there is Naishthik Brahmacharya and then there is Vaivahik Brahmacharya. It does not say total abstinence. So there are rules for how to indulge into sexual act. There are rules for that. Then there is a charya for a woman when she's menstruating. There is a charya after the menstruation. There is a charya when she's pregnant. There is a charya for when you are trying to conceive. So there are charyas for everything. Now, why so many charyas? So a lot of, I think, people my age would think ki yaar, everywhere they just want to give us rules, follow this rule, follow that rule. But see, these are guidelines uh, for a bigger aim. We have a reproductive system in place for the continuation of the species. Okay, we have this system in place so that it can be continued. Therefore, maintaining an optimum level of Shukra and Shonit, that means your sperm and the ovum, should be of best quality when you're trying to conceive, especially then. And Shukra is the last of the dhatus. So we have 7 bodily tissues which are explained in Ayurveda, starting from Rasa, which is the first one that is formed just after food. So Rasa, Rakta, Mamsa, Meda, Asthi, Majja, and then the last one is Shukra. It's the 7th dhatu. Shukra is not equal to semen. Okay, Shukra actually refers to the entire cluster of hormones in our body, specifically the reproductive hormones. Okay, it refers to all of them, and Shukra is present in both males and females. It's not that it's present only in males. So it is present in both. So maintaining a good Shukra, good quality of Shukra, we have a description of what a good Shukra looks like. So what happens is that nowadays infertility is so common in males because of specific reasons, and in females, one of the major causes PCOS. So we end up testing our reproductive system only when we are married and infertile, or we are having in females when we are having some of the signs and symptoms of PCOS. So men will go for a semen analysis, women might go for an ultrasound or some other hormonal test. They'll check their LH, FSH, prolactin. But before that, what? How do we prevent it? We don't know. But in Ayurveda, we have a clear-cut description of what a Shuddha Shukra looks like, what a Shuddha Artav looks like. That means how should your normal, natural menstrual blood be? How should your normal semen look like? If you know this, if you have this knowledge, you can yourself become a manager of your health. You will yourself know where things are going wrong and when you have to seek help. Because you will know ki aaj or since a little few days, the quality is probably not okay. So I need to go and see a doctor. But if you don't know it, then you will not be able to go. So these charyas are set in place so that optimum level of Shukra and Shonit is formed. We are seeing nowadays that so many women are suffering with PCOS. There is precocious puberty that is happening. Women are starting to, the age was between 12 to 16. It has come down to 9 and 8 now. When women are starting, their menarche is happening at the age of 8 and 9. That is because the optimum quality of Shukra and Shonit is not being maintained. All the disorders that are happening nowadays, irritation, frustration, which can again, they can be a cause of all the lifestyle disorders, and they can also be a repercussion of the lifestyle disorder that we have. So we are becoming prone to this because our genes are not strong. And when we see it from the point of view of Ayurveda, it clearly says Shodhan, Ritu Shodhan, detoxification. Yearly thrice, they have told that you detoxicate yourself. And especially when they are talking about conception, they say that a woman and a man both should undergo detoxification before they are trying to conceive. Because your sperm and ovum should be of the optimum quality when you are trying to conceive, so that in that moment, you are able to produce a healthy progeny. Because ultimately, the reproductive system comes down to making this race run. So therefore, all these charyas are very important, and following them is very important because they will help in making healthy tissues and further better conception. The conception will also be good. Your gynecological problems will also be avoided, and the child that you're producing will also be healthy. Yes, sir.
You made some very important points. And we tend to look at this whole reproductive process as something which is meant for perpetuation of the species, which of course is important, but then as I said a short while ago, it's much more than that. And in terms of Sri Aurobindo and the mother's philosophy, in fact, it is not just continuation or perpetuation of the species, but improvement of the species, because there's a strong evolutionary thrust around. And therefore, now we have a possibility. We are living through fantastic times when there is a transition taking place, and we have an excellent opportunity that if we use our consciousness well, we can accelerate the uh, increase in the level of human consciousness many steps in a relatively short time. So the consciousness can improve during the next few decades and centuries much faster than it has done in thousands of years earlier. So I think it is much more than just continuation. It's a conscious effort at improving the next generation. Uh, Dr. Surinder Katoch had emphasized sleep quite a lot, and coupled with that is also eating, because if, 10 to 2 being the pitta kal, not only during the daytime but also at night. If the person is awake from 10 to 2 at night, the person tends to get hungry. And while I mean that pitta increase in pitta at night was meant to uh, digest the food for metabolism of what had been eaten during the day, it ends up expressing itself as hunger. And that's why now we have places where you can order food 24 hours a day and it will be delivered at your house. And young people are doing that. They're getting it, say a pizza at 2 in the morning. Now it's so unnatural. So both unnatural hours of sleep, disturbed sleep, and inadequate sleep, and then eating at during the night. Mukta may be more familiar with the young people doing all this in hostels, so maybe she can comment on what she thinks all this can do. And of course, it's a very important topic. We may not be able to say everything today. Maybe we can have a separate discussion only on sleep one of these days, because one of the most important and yet one of the relatively neglected components of lifestyle. We tend to emphasize diet and exercise a lot more than sleep. But still, a few words on sleep may be in order, because especially in relation to polycystic ovarian syndrome, it seems that sleep uh, is a very important component of the lifestyle, which is increasing its prevalence. So Mukta would like to talk about what young people are doing these days in relation to sleep and eating during night.
Yes, I would like to, and I'm also sharing my screen here. I would like to just draw something and explain. So, if suppose we have a circle, we just make a clock and we just divide this into, uh, 1 second. So if we just divide this into 6, okay? So this is, let's say, 6 a.m. and this is 6 p.m. So what happens is, this is the time of 6 a.m. to 10 a.m. is the time of kapha. 10 a.m. to 2 p.m. is the time of pitta, like Dr. Bijlani said. And then 2 p.m. to 6 p.m. is the time of vata. Same as for the night. 6 p.m. to 10 p.m. is kapha. Then 10 p.m. to 2 a.m. is pitta. And 10 a.m. to 6 a.m. is vata. Okay, we have this circle with us. Now, what happens is, when we want to sleep, what should we have? Should our body feel very active, or should we feel a little lethargic so that we can just go to bed easily? It's very easy to understand. We want to feel dizzy so that we just go to bed. Our brain shouldn't be active. So we need to sleep in the time of kapha. That means between this 6 p.m. to 10 p.m. This is the time to go to bed. That means you are in sync with the clock that is there in the environment. When you wake up, you want to be light and active, or you want to be very sleepy? You want to be active. So to understand that, you have to wake up in the last part of the night, that is between 2 a.m. to 6 a.m. You will see most of the people who are doing very well in their fields, they wake up in the Brahma Muhurat. And Brahma Muhurat is 1.5 hours before sunrise. So irrespective of what field you belong to, it is called the creator's hour. In English, Brahma Muhurat is called as the creator's hour. So any creation you want to do, whether it is art, whether it is your science, whether it is your finance, anything, whatever you want to do, you can excel in it just by following early to bed and early to rise makes a man healthy, wealthy, and wise. A lot of people don't even know this quotation now, but this is very simple, but very powerful. This is very powerful. Now, when we talk about pitta, this 10 to 2 time in the morning, the afternoon, 10 a.m. to 2 p.m. is the time when you have to take your first meal, because the sun is at its peak, your hunger is at its peak, So the heaviest meal that you want to have, or the first meal that you want to have, has to be between this time. And if at all you are taking a second meal, that should be around 8 hours after this. So it will fall between your around 6 p.m., 6 to 8 p.m. It will fall around that time. The night 10 p.m. to 2 a.m., again, it's the time of Pitta. But now, for example, we have two metal pieces. If we want to join them, what do we need? We need heat to solder them together. Similarly, all the wear and tear that is happening in the body throughout the day, it needs to undergo a process of regeneration. So that fire in the body is actually needed for regeneration, which happens if you are asleep between 10 p.m. to 2 a.m. But since we are not sleeping during that time, we end up degenerating a lot during the day and then not regenerating anything at night. So for a lot of people my age, I see they are exhausted by the time they turn 30, because their body tried to sustain it, tried to sustain this unhealthy lifestyle for some time. But by the time they turn 30, it's gone, because there's nothing left. There is nothing left to sustain, because degeneration, though, it will happen. See, I'm an anatomist, and the definition of sharir is shiryate iti shariram. We think that we are building a body, but Ayurveda says that body is actually undergoing a continuous process of degeneration. Okay, the definition of sharir means degeneration. So if there is degeneration that is happening on a daily basis, construction is also very important, which the youth forgets. We think sleep is a waste of time. We think we focus maximum at night. This is stupidity, because this is slow poisoning. Okay, it's going to poison your system. And we have a concept of kha vaigunya in Ayurveda. Kha vaigunya means whatever part in your body is weak. Okay, whatever part in your body is weak, that will get affected. And at present, what is happening, since our food is not good, since our lifestyle is not good, gradually from rasa dhatu to shukra dhatu, all the dhatus are depleting. Now the last dhatu is shukra dhatu. Okay, so what happens is, since it's all depleting, the main attack of all the causative factors that you consume is becoming your reproductive health. Infertility is so common. Premature ejaculations have become so common. PCOS in women have become so common. All these problems are and the problem with this is that this becomes a vicious circle. So because you have this problem, you end up into stress. Because you have stress, the problem increases. So it's a vicious circle. And the only correction that you need to do is actually your lifestyle. So it is very important. Discipline is very important in terms of what you are doing throughout the day, especially your sleep pattern and the food you are eating. Night is not the time to eat. Night is not the time to stay awake. Raat ko ullu jaagte hain. Humans have to sleep at night. So we are not ullus, we are humans. And for us, the time to sleep is between 10 p.m. to 2 a.m. See, depending upon how much you require, an adult usually requires 6 to 8 hours of sleep. Anything less than that, if you are a yogi, you can attempt for lesser hours, but at least 6 hours is needed. And it has to be proper night sleep. Not ki there are few people who've come to us कि हम 2-2 घंटे करके सो लेते हैं, 2 घंटे दोपहर को, 2 घंटे सुबह, 2 घंटे रात को. Not like that. Proper 6 hours continuous night sleep is needed for an adult. And if you are following these very basic things, you will start seeing changes in yourself. And this is to all the young people who are watching me.
Thank you, Mukta. That was indeed very enlightening and very relevant in terms of the type of lifestyle most young people have these days, under these wrong impressions that sleep is a waste of time. You can focus on studies more at night because it's all quiet and silent and so on and so forth. And, all these are such faulty impressions, but so common these days. And that reminds me also of something which your mother once shared, and she has shared, I think, quite often, that people don't know that early to bed and early to rise makes a man healthy, wealthy, and wise. Instead, what they say is that early to rise and early to bed makes a person socially dead. So that is much more common than the wiser, time-tested, time-honored dictum. So Now, again, maybe you can say a little bit about the behavioral issues which Dr. Surinder Katoch talked a short while ago. In that, while I mean behavioral issues may be the cause, but and they are also the effect of the disease, because once the person, say particularly has the young person, even unmarried, has very heavy periods, which is one of the symptoms in some of the people, some of the girls with this disease. So if there is too much of loss due to bleeding, now that can really make a person very weak and worried. So depression, anxiety, these things can follow the disease, and that is what may be the dominant symptom when the person comes. So would you like to touch on that? Of course, I mean, one has to go to the roots, no matter what the manifestation. And you have been talking about the roots of the disease, but would you like to say anything particular about the behavioral problems that arise from the disease?
Dr. Katoch, I think you can take that.
See, when we talk about the behavioral problems, again, we say mind affects body, body affects mind. Because a person is suffering from PCOS, then a person enters into frustration, irritation, depression. And because a person is suffering from depression, frustration, irritation, a person develops PCOS. So if we say behavior symptoms are secondary, it's not true. They can be primary also, and because of that, this PCOS is happening. So they are interdependent. Then you take medicines. Like I have a patient right now, case of PCOS, but has produced a child, but now entering into menorrhagia and then polymenorrhea, lot of bleeding she's happening. And then she found out there was a fibroid, and she's only 40 years old. So there is a, and now she entered into HRT, hormonal replacement therapies, because she entered into a lot of frustration, aggression, anger. So those medicines were given. Now the result of the medicine was basically given to reduce the size of fibroid. Now she wants to have a second issue. Now the fibroid is there. So medicine is given to reduce the size of fibroid. She took for 3 months and the size didn't decrease. Now the medicine has been changed. And now the medicine has been changed and the size has decreased from 7 centimeters. It has come to 5 centimeters. Now the result is the medicine she has been taking for 6 months. And now she has come to me that the second dose, when she started for a 3 months next medicine, with that the size of the fibroid has decreased from 7 to 5 centimeters. But for 3 months, she entered into amenorrhea. She didn't menstruate at all. Now, within these 6 months, she has increased 20 kgs of weight. The vicious circle, mind affecting body, body affecting mind. Now that further depression has started, that she has entered into obesity. So the weight has increased. Now she is again entering into depression, frustration, anger. Nothing is working. So the point is that PCOS, number of patients I have who are suffering from PCOS but have produced children. It's not essential. Every girl who is declared as a patient of PCOS thinks that she can't conceive. Even the parents think that, oh my goodness, she's suffering from this and ultrasound mein ye aa gaya hai. Now the conception is going to be very difficult. But it's not always so. It's not always so. It can be, but not always so. But because a lot of stress comes in between, that disturbs the biochemistry. And a lot of other diseases pop up. And ultimately, that patient ends up into all psychological disorders. And then ultimately, finally, the thing happens is mal interpersonal relationships. So her relation with each relation, whether it is in her married life or with her parents, every relation gets disturbed. And the end result is number of persons, either they end up into their own room, or they are on the roads, or they start drugs. So the whole life gets distorted. So therefore, a simple formula for remaining healthy is just follow the lifestyle by which you can prevent all these bodily as well as psychological problems.
Yes, that's very true. I mean, the fact is that the world has changed a lot, but at the same time, even in the modern world, we have very ancient bodies. And
Yes,
therefore, the body still behaves the way it did thousands of years ago. And
correct.
some basic things can't be neglected, and we just have to adapt those principles to the modern world. We can't discard those principles. That is what is
Correct.
important. And any attempt to try and discard those principles has always been punished with all the problems like PCOD.
Yes,
So, I mean, PCOD is a very, or PCOS rather, is a very complex problem. And
yes,
since it has a variety of causes and a variety of manifestations, one can't talk about everything about this issue in such a short discussion. But you brought out some very important points which would be helpful to anyone who wants to prevent or manage this problem. And of course, for managing it, there's no substitute for actually seeking medical advice. So one can't do that in a discussion like this. But same time, since it is a very general problem, probably underreported, sometimes deliberately because girls are shy to share it with others. So therefore, in a public forum like this, I think it is important that we try to increase both the awareness and also the ways in which this problem can be reduced and perhaps eliminated if we have the will, because all it needs is a strong willpower. And even in case of an important factor like sleep, the fact is that everybody has exactly 24 hours. That is something with respect to which we are all equal. And if we try to sort of sleep less, even at the wrong time, we incur a sleep debt, which we make up by sleeping more at some other time on some other day. The result is that there's very little actual real saving of time. And why not then sleep at the right time in the right way? So that at least the time when we are awake, we are more efficient in our work and also stay healthy. So it's as simple as that. But the simple logic somehow we escapes because everybody else around is not doing it. So we have a tendency to conform, to do what others are doing. But it would be much better that if we apply our mind, and if everybody applies the mind, then everybody will be doing these sensible things. And then we will be doing what everybody is doing and still doing the right thing. And that should be our aim, because uh, that is something which is within reach of everybody. So maybe you can have a few uh, last comments, message sort of to young people, particularly young girls. But I think not why young girls. I mean, these lifestyle issues are the same for boys and girls both. And in fact, can be a question that while in girls it can manifest as PCOS, and in which ovaries may be sometimes quite significantly involved in the form of cysts or just absence of ovulation or irregularities in menstruation or infertility. Uh, what is the male counterpart of the same type of lifestyle diseases? Is there a male counterpart to it in terms of
yes,
reproductive system?
yes. Like we have Asht Arthav dosh, the
Mm.
dosh of the female hormonal system. Similarly, we have the Asht Shukra dosh, which goes towards the male. So it is both ways. It's not only that lifestyle will hamper the female only. Lifestyle is equally going to hamper the male productivity also, because we do have patients nowadays that the males are not able to perform the sexual act only. And azoospermia, that has also become very common nowadays. Or oligospermia, that has also become very common nowadays. Or the people, the lifestyle, the way they are having, the lifestyle, the way they are leading the lifestyle, they don't have an urge for sex. Because urge is just into the race to earn power, prestige, money. They don't have the urge only. So that is where the compatibility is not happening. And all these are because of the lifestyle only of today. And if Mukta would like to comment more.
Yes, I have a few things to add. So, just starting from where Dr. Katoch has left, that all these causes can have similar and different impacts in males and females. What we do wrong is that women want to become like men and men just want to become more men. So that is where we just go wrong. One of the most ancient aspects, and I think the yogic aspect, is that each one of us is made up of Shiva and Shakti. Each one of us has Shiva and Shakti. Okay, each one of us has the masculinity and the femininity within us. The aim is not to nourish the femininity in women and nourish the masculinity in men. The aim is to balance both the energies in your body. Okay, so a person who will be able to achieve that will always stay in a state of balance. What nowadays, even most of the parents, I mean, for the youngsters, sometimes it becomes very difficult because the generation before us is actually sometimes making it very difficult for them. So unko hota hai that a man should find a woman and a woman should find a man, and that is how the life is going to run. But amidst this, they forget that their children actually need to balance those two energies within themselves. And the main problem nowadays is that the youth of today is actually seeking that. Because, see, they have seen money, they have seen all the comforts of the world. But the spiritual direction is something that is missing. They're not finding it at home, and they're finding corrupted information everywhere else. So, this is something that they are seeking. But a lot of parents are pulling them back. They're not letting them move in that direction because they are scared ki, I don't know what, ye tantric ban jayega ya ye kuch kar lega. So they're scared. But I think these are things that need to be openly discussed. Even sexual health, coming to things like PCOS, all these reproductive disorders, these are not a taboo. They need to be discussed. They need to be brought into the limelight, and they need to be addressed just like any other disorder. And for the girls, see, identifying the cause of your PCOS is very important. It is, you can't just let it be. But after you identify the cause, you have to empower yourself with the right knowledge. You need to know what is good and bad for you. You need to become good time manager. When you say that I am like men or I am very good at work, you also need to be good at managing yourself. Why are you suffering from this? Also, a lot of people, like rightly you pointed out, that girls, when they come to know, they've accidentally they went for a piece for a this ultrasound, and they found out that they have PCOS, and immediately they are into depression. They're scared. What should we do? That shouldn't happen. See, sometimes there are certain stresses that can come in a woman's life, even a man's life, but a woman's life, there are more chances of having certain kind of stresses when you're moving from a family to another, you're producing a child, so you can be more prone to those stresses. Give your body time. Just don't be scared that once it has happened, so it's going to stay with me for the life. It's not going to be like that. If you've developed PCOS by chance, it is not an uncurable disease. If you're going to follow the right management, if you're going to follow the right lifestyle, you can always come back on track. So don't be scared. Just empower yourself with the right knowledge. Also, I see a lot of information floating around that periods are like taken for granted nowadays, and people are actually misusing it. A lot of women also. So don't make your periods a base for bad behavior. It's not that. So people say that she's on her period, so she can just do anything she wants. You should pamper her, and you want to binge eat. You want to eat a lot of chocolate. You want to eat a lot of junk food. No, because after that, you will immediately have guilt. And then that guilt will become depression, and then it will again be a cause of your disease. Okay, so don't fall into this vicious cycle. Ayurveda says when you're menstruating, your diet should be light. It has to be easy to digest because your body is already undergoing so much. So let it just chill out. Let it just relax. So don't give too much burden to it, either in the form of physical activity. There is, isme koi mahanta nahi hoti hai that I'm on my periods and I'm going to do a lot of physical exercise. Because see, when you're doing physical exercise, vata is increasing in the body. Okay. Once this vata will increase, if you're going to overdo it, it is going to dry out that menstrual blood that's coming out of your body. So you may end up with amenorrhea. You may end up with dysmenorrhea. Okay, so don't do these things. Give your body rest. Aajkal, a lot of organizations, they are giving menstrual leaves. They have started this, which is a good thing. It's not a bad thing. And there is no need to feel that I am weak. It's not about being weak. Your body is going through something. Just give it time. Just give it time, relax, chill, eat light, and just enjoy. Okay, this is actually a time you can actually grow spiritually if you want to, but only if you want to. So these are the things. And sexual health is very important, not just physical, but mental. And don't seek validation. Okay, don't look for validation from others, from your peers, because if you are doing wrong, probably your peers are also doing it wrong. Okay, so don't look at what your peers are doing. Even the information that you're consuming through social media, whatever you receive on Instagram, whatever you receive on WhatsApp, check for the authenticity of the content. Don't just blindly follow anything. There should be a reference to what these people are saying. There should be some authenticity to it, because otherwise it is just any information you are consuming and it may harm you. It may not be even good for you. So be conscious of what you are consuming. And yes, just relax. Don't take it very seriously. But yes, if you have a major problem, seek professional help. That is very important. Don't just try to ignore it or hide it under the blanket, because it will just get worse. It will not better like that. Yes.
Thank you so much, in fact, bringing out some very important points, both for men and women, boys and girls. Maybe one last question I can ask you. In girls, it often manifests as early menarche, not the disease, but I mean, that has become a common trend. Uh, in case of boys also, does it express as early puberty?
Yes, it definitely does. Because nowadays, I think, because I have kids at my home, not my kids, but my husband's elder brother, he has 2 kids. So I see the kind of content they are exposed to. Even the normal content that is kid friendly sometimes happens to be very sexual. So it is very natural for kids nowadays to have an early puberty, whether it is men or whether it is women. Both can have early puberty, and they do. We see the age that it is coming down. Even in schools, you will see the kind of conversations the kids have. We feel that हम तो बुद्धू थे हम तो क्या बात करते थे, because we were literally very buddhu. They have very mature conversations, so they mature physically. Now what is happening, because they're having these kind of conversations, they are exposed to this kind of content, and the hormones are going to show their play physically, so they are maturing physically very fast, but their mind is not able to process that growth, because mind is not used to. If they are 8 years old, and see, when I was 12 when I had my menarche, and a girl who was having it at the age of 9, her mind is not ready to accept it. Her mind doesn't know what to do about it. So this difference is coming, and therefore for the parents also, it is very important that if it's happening in the society, we need to address it, and we need to keep a check on what kind of content the child is being exposed to. Technology is important, and it's inevitable. It will not go away. We cannot make the technology zero for our kid. But yes, we can limit it. So we have to limit it. We need to inculcate the right kind of values in the child. We need to have that kind of freedom and space so that the child can talk and communicate whatever difficulties the child is having, so that whatever issues the child has can be addressed at the right time, and they don't seek help outside. They don't go to their peers, because peers at that age are also unstable. They are also talking because of their hormones. They're not talking about with some sense. Okay, so they should not go to their peers to seek help, because they might not give the right advice. So it's important for parents to equip themselves with the right knowledge, become good human beings themselves so that they can guide their children better and help them better.
Yes, I think this last point that you made was very important, and maybe we can stop with that. That instead of seeking advice from peers, it's better to seek it from the right sources, maybe a little grown up sources, grown up teachers, parents, and so on. That would be much better. Uh, the reason why young people turn to the peers is because, firstly, they can relate more easily with them. Secondly, they feel that the advice that comes from the grown ups, parents, and teachers is maybe good, but is designed to take away their happiness. Now, this is a misconception. Parents and teachers always want their students and children to be happy. So their intentions are always good. Sometimes the advice may not be right because of misinformation, even they don't know everything. But their intentions are always good. And on the whole, they are likely to know more than their peers. And because at least they have seen more of life. So this is something which the young people need to understand. And the grown-ups also have to keep this in mind to emphasize that they're not out to take away their happiness. They want them to be happy. They want them to be healthy. And uh, if they don't know, they can work together to find out the right information. And at least that is one thing which is easily available now. And also, it's not very difficult to sift out the authentic information from misinformation. Because if you do, say, a search on a search engine like Google, at least the top few entries which have stood the test of both time and the world. As you know, Shirbando's language I'm using, anything which has stood the test of time and the world is rarely wrong. Time, because that entry has been there for a long time there. And the world, all over the world, people have found it better, and therefore it has grown in popularity. And that's how it has risen to the top. So the top few entries are likely to be more authentic, and then some are more prestigious than the others. Like, for example, Wikipedia. It's one of the more prestigious sources of information. So turn to more authentic, more prestigious sources. The parents and the children can work together on it so that the parents also know more. And that would be the right way, instead of depending upon the peers, as you said, who are not speaking themselves. It's their hormones that are speaking. So I think with that, since time is running out, we can stop this discussion and continue these important topics like sleep and sexuality and so on in some other discussions with a little different context. Thank you, Dr. Surinder Katoch and Dr. Mukta Katoch, for sharing all this valuable wisdom and insights with all of us. Thank you.